Guidelines for euthanasia of cattle. I think euthanasia in general is a pretty difficult topic, at least it is for me. It's personal to some extent. I always struggle when I go to present this kind of a topic, and it may seem strange to some folks, but really it is a personal kind of thing. And I think it is for all of us veterinarians, and for reasons I'll share as we go here. Certainly, I think, as I think of this as a veterinarian, if I were to look at the veterinarian's oath, the line that probably sticks out the most to me is that the prevention and relief of animal suffering. And in 2010, we revised this so that it's the protection of animal health and welfare as well, which is a good thing because really, prior to that, and I can think throughout my entire education in veterinary school, I don't think I ever heard the word welfare ever mentioned. And that seems really odd when I think back on it, but it's just reality that today we're paying attention to things that we should have paid attention to 40 years ago. And why we didn't, I don't know. It was certainly intended and it was certainly implied, but it was never really spoken. And neither was the topic of euthanasia. We didn't learn near enough about it, and I'm afraid it's still the case today. And it's changing rapidly, and I'm really glad for that because this is one of the most important things that we do. It's also a paradox. The veterinarians are trained to help in nature's healing process, but we also treat our patients with the knowledge that some of them will be ultimately slaughtered for human use. At other times, we're called upon to perform euthanasia, but not always for humane or medical reasons. I find a lot of young people today struggling with this, right? They struggle with the idea of slaughtering animals for human consumption. And some are surprised at that. Why are we surprised at that? That shouldn't surprise anybody. Everybody has to deal with that at some point in their life. And then euthanasia to manage overpopulation, dogs and cats. These are tough issues, right? Tough issues, for sure. And indeed, I see people throughout their educations in veterinary school struggling with these issues, as well they should. These are important things to think about. I like this from Albert Schweitzer. To the man who's truly ethical, all life is sacred, right? Including that which from the human point of view seems lower. Man makes distinctions under the pressure of human or of necessity, as for example when it falls to him to decide which of two lives he must sacrifice in order to preserve the other. But through it all, he bears the responsibility for the life that is sacrificed. That's correct. We should all think that way, and I think that we do, even though we don't allow ourselves to actually express that or allow that to really be known. I like what Temple Grandin has to say about some of these issues when she talks about the emotional states of certain packing plant employees when they're assigned these unpleasant tasks such as stunning, right? You have the caring types, those who demonstrate an obvious empathy for the animals. You have the box staplers, right? I can understand that one as a veterinarian. They become mechanical, capable of displacing their emotions from their work. At times we have to do that. They're the sadistic folks. Fortunately, not many of those, but we have to be aware that there are some people, and we just saw that in the previous presentation. Those who approach the task with reverence as though it were a sacred ritual. Yeah, that's the way it should be approached. And when it's approached that way, I think all of us can feel more comfortable about the slaughter of animals for human use. Yeah, that's the way it should be. That's the way we should look at it. We should approach it with reverence and caring. Here's the one that makes me a box stapler. I've done this when I was in practice. I became a box stapler because I had to make the monthly visit to the local humane shelter and euthanize dogs and cats. That will make you a box stapler. I focused on hitting veins. I couldn't do it otherwise. It was very difficult, right? According to the ASPCA, of the 5 to 7 million companion animals entering shelters today nationwide, 3 to 4 million, that's 60% of the dogs and 70% of the cats, are euthanized. That's inexcusable. That's inexcusable. That's a sad commentary on humankind. So it's important to remind ourselves of these things, and I struggle far more with justifying that than giving an animal a good life, taking it to slaughter, and humanely slaughtering it. All of those things are important, but it seems like we lose perspective at times. And I'm not trying to justify either. I'm just trying to say that I think we need to look at these things carefully. It causes us to want to think about the talk. I really like this little piece. I want to share it with you here. I doubt that any of you have had this particular talk.
Honey, we need to talk.
About sex.
Yeah, we think you should be having it, sweetie.
A lot of
Get
it.
up there and nail everything you can.
If it's got a pulse, you should be wrapped around it.
What if I get pregnant?
So what? You should pop out all the kids you want.
Absolutely.
Yeah, we can leave them in the shelter, dump them in the street,
It's
whatever.
really not important.
I'm really glad we had this little talk.
My little girl's gonna get some.
Isn't that good? It is good, right? And it makes the point. The caring and killing paradox, it's important. It's a reality. It's experienced by shelter workers, laboratory animal technicians, young people in 4-H and FFA programs, and many more. It's marked up by depression, grief, and other destructive behaviors. It's written about a lot. You should read some of these things. It is really a real situation. It's a real scenario that people face in these situations. This is also something that I fear as a cattle person that's sometimes forgotten. Or when people who look at us who don't really understand why we do what we do in the livestock industry need to think about this. I love this from Dr. Jessica Lauren. I've had to euthanize cows for producers who could not do it for themselves. Many beef producers become very attached to the animals they care for, and they get a true satisfaction in caring for the animals in their possession. Absolutely right. And I hate these broad brush attacks that we get from time to time from people who don't understand. This is what I see in the dairy farmers that I know. This is what I see in a lot of the cattlemen that I work with. They do really care. Well, I wish it was 100%. It's not, obviously, but the majority, the overwhelming majority do care. And sometimes we're painted with a broad brush as being insensitive. It's not that way. It's not that way. In a perfect world, we would preserve all life, relieve all suffering by medical or other means. It's just not a perfect world. Reality is there are many conditions in animals, whether caused by injury or disease, that result in excruciating pain, horrible suffering, and cannot be relieved by any other means than euthanasia. That's reality. That's the life that we live in. It's important, I think, and we wouldn't even be talking about this today or at any time, except for the fact that for an animal to experience something, it must be both sentient and conscious. An unconscious animal experiences nothing. And I'm going to come back to that just a little later. But it's important that we understand the concepts here that make it possible for animals to suffer. Sentience is the ability to feel or perceive pain or experience some form of emotion, whether it is positive or negative. It requires a nervous system that is functionally capable of cognition. and the ability to emotionally experience its status as bad or good. So our objective in humane euthanasia is a good death, whereby life is ended without pain or distress to the animal. It's one of the most important things that a veterinary student ever learns, is how to do this job properly. It's so important because this is one that none of us in livestock care, and particularly those of us as veterinarians, can escape. The reality is that at some point in our professional lives, this is going to be a task that we're going to need to be able to provide. It requires techniques that induce immediate loss of consciousness followed by cardiac and respiratory arrest, which results in loss of brain function and death. These are the methods that are recognized by the MVMA as appropriate for the euthanasia of beef and dairy cattle. Barbiturates, barbituric acid derivatives, gunshot, and penetrating captive bolt with adjunctive methods to assure death. Euthanasia using a barbiturate or barbituric acid derivative. These are anesthetic agents, of course. They generally result in a very smooth transition from consciousness to unconsciousness and death. But there are several important deterrents to these methods. One is cost. I wouldn't put that necessarily as the first and most important, but it is a factor, particularly where large numbers are to be euthanized. The administration requires restraint, which also causes stress to the animal, and in some cases, a great deal of stress to this animal, and that becomes an important consideration in the procedure that we consider. It must be administered by a veterinarian, someone licensed or registered with the United States Drug Enforcement Administration, and strict accounting of the drug use is required. And carcass disposal is very complicated by drug residue, and that's becoming more and more and more of an issue all over the country. And carcasses not disposed of properly may pose risks for wildlife. Those are all important considerations and need to be thought of whenever we consider the option of a barbiturate for euthanasia. Share with you this video of an animal that is to be euthanized with a barbiturate. Of course, we have a halter on the animal, and this is a dairy cow which is very accustomed to human contact. But even here, there's a certain degree of distress that occurs that simply doesn't occur with other methods that we can use. It's not a great deal of distress, I grant you, I agree. But those of us who do this know that this does cause some degree of distress, and certainly in an animal less accustomed to human contact than a dairy cow. But it does provide that smooth transition from life to death that so many are looking for and would like. It's not a violent thing at all. And so for many, this is by far the preferred approach to euthanasia. I understand that. And in many cases, this is the appropriate approach. Certainly where there's a great deal of emotional attachment in a situation, this may be by far a better approach than maybe some others I want to share with you. It's important to also recognize that euthanasia of the dam using pentobarbital results in a situation where, although the barbiturates readily cross the placenta and cause fetal depression, in fact, the dam dies way sooner than the fetus, by as much as 20 to 25 minutes. So what happens to that fetus, right? I want to talk about that a little later because that is an important consideration for us. It is an important thing for us to think about. I want to share some thoughts with you about that a little later. Use of firearms for euthanasia is a very common method. In fact, according to the work of Fullwider, it is by far the most common method used for the on-farm euthanasia of cattle. The effectiveness depends upon, of course, the selection of the appropriate firearm, the type of bullet or shot shell if we're using a shotgun, and of course accuracy of aim. This is a euthanasia using a .357 Magnum in a down dairy cow. And I want you to keep in mind what we just talked about. Although this is a more violent kind of approach, I want you to remember that in so many ways it is so very, very humane and does not bring with it the distress that comes with other methods. The animal is immediately unconscious and will die very soon, within minutes, and never ever regains consciousness. But albeit it is violent, right? And that is the problem for so many people. But if we understand what it is we're doing, we understand how to do this procedure correctly, and we get beyond some of those concerns that we have with respect to the aesthetics of this issue, and recognize what our objective is to create immediate unconsciousness and damage to the brainstem that will result in death. This does it very, very well. Always take time to confirm death. Always take time to confirm initially after this is completed that the animal has in fact been rendered unconscious before we ever leave. Rendered unconscious and rendered fully dead by the time we leave this animal's side. Properly applied, euthanasia by either gunshot or penetrating captive bolt causes less fear and anxiety, and induces a more rapid, painless, and humane death than can be achieved by most other methods. That's an important take-home for you, despite the fact that it may be uncomfortable. The reality is that so many people today that I find in veterinary schools, men and women for sure, have no experience with firearms. One of the things we've tried to do to remedy that is to be sure that our students do have at least some exposure to that. We bring in hunter safety instructors, and we talk about firearm use and safety, make them comfortable with it, so that at least when they get to the point that they may need to apply this themselves in a farm situation or whatever situation they may be in, they may be comfortable to do so. That's the way to approach this thing. Until we have better methods, this is one of the methods that we need to keep in mind is a very appropriate method and a very, very humane way to accomplish this task. I don't want to spend a lot of time talking about the details, but we can use handguns, 32s, anywhere up to 45s, rifles, not a 22 long rifle, but at least a 22 Magnum for those of you who are into firearms. We find that the 22 long rifle simply cannot be recommended for euthanasia of dairy cattle, large adult dairy cattle, or adult bulls, adult cows, beef cows, simply because the results from the 22 long rifle are not consistent. We need to go to a 22 Magnum or higher caliber. Shotguns of 410 to 28 gauge are great for calves and young animals, and then we can go to the 12, 16, or 20 gauge for cows, and we can use birdshot in the 4 to 6 range, or we can use slugs. Shotgun is very lethal at close range and very effective for this purpose. If we're using firearms such as pistols or rifles, we need to be sure that we're using solid point bullets. We want this bullet to traverse the skull. We want it to hit the brain stem, because that's what's going to cause cardiac arrest and respiratory arrest, and that's what's going to allow this animal to proceed to death. We do not want to use hollow points. It's when I go to farms, and I'm just visiting farms, and particularly when I'm visiting to see what kinds of ways they may be euthanizing cattle. If they're using firearms, that's one of the first things I always check. What is the caliber of the firearm, and are they using an appropriate bullet? It's just that simple. Those are very critical things to be checking. Penetrating and non-penetrating captive bolt. Captive bolt induces an immediate unconsciousness, but death is not assured by captive bolt alone. We need adjunctive or secondary methods to assure death. Sometimes a second shot, sometimes exsanguination, or pithing, which is to take a rod of some sort, put through the hole made by the bullet or by the bolt to increase destruction of the brainstem to assure death. And then the other one that I prefer for myself is intravenous administration of a saturated solution of potassium chloride. There are many types of devices. These are just a couple. I like the one on the left because it's not hard to tell which is the business end when you're using this. And these devices, of course, can be dangerous, and so it's important, I think, to utilize one that you're comfortable with. And most people find the cash special quite nice. The problem here is it's quite expensive, about $1,600 for this particular device, whereas the inline on the right there is a much more realistic cost-wise captive bolt. This is the kind that's used as a non-penetrating captive bolt stunner. It is only used on calves and young animals, never to be used on adults. It has a mushroom-type head, as you see here on the left. And not sure if I know how to work this, but that makes for a very nice device for the purposes of euthanizing calves. Penetrating captive bolts are powder-activated devices. It's important that we have good restraint of the head before we use this particular device, because we need to hold it flush with the skull to make it work appropriately, as I'll show you in a moment. And then our injectable agents, potassium chloride, should never, ever be used, of course, as a sole method of euthanasia. Potassium chloride causes cardiac arrest and should only be used, and is only to be used in unconscious animals. It's given by rapid intravenous administration, and we use a saturated solution of potassium chloride to accomplish this task. And you can make that by putting 340 grams of potassium chloride in a liter of water. And you can use potassium chloride as simple as that comes from the water softener salt that you buy. And then much of that, of course, is sodium chloride, but there's also potassium chloride that can be purchased in that way. So it's a very effective way for accomplishing this task. There are additional methods. The second shot, as I mentioned, exsanguination is very disturbing for onlookers. I don't like to use it myself. It disturbs me. As I said, this is a personal thing. It's difficult, right? So I don't use that one. It's not my choice. It bothers me. Pithing, you can also do. That bothers some people as well. So you see why I like the potassium chloride method. This is a cow that we're going to euthanize here by use of a penetrating captive bolt. It's a penetrating captive bolt. It's an inline version. This cow's been down, as you can see, for several days. Her eyes are sunk. I always put a holder on the cow. This is just my protocol for using captive bolt. I always use the holder, and in case I need to, I can restrain the head, because I want this captive bolt to be able to sit firmly on the cow's skull when I fire it, and then I'm ready to apply the intravenous potassium chloride then as soon as I can, as soon as the animal is unconscious. I carry two syringes of 60 C's full of potassium concentrated or saturated solution of potassium chloride. I always give them both. I'm not sure that I always need the second one, but I always give them both. And that usually, I've never known it in the ones that I have done. I've never known that that I've ever needed to give more. And again, always confirm death. It's important also to remember that causes of captive bolt failure are primarily poor maintenance Temple Grandin has spoken on this and makes this point very well. Stunners should be cleaned regularly after use. Damp cartridges can be a problem as well, so they need to be stored properly. And for pneumatic stunners, from time to time, there may be low air pressure. That usually gives us an indication that we need to check the device. On our website, we have a couple of videos. I'm not going to show the whole video here, but it shows how to clean and maintain this particular device. I encourage you to go to the website if you know of anyone who may be using this device, or if you're wanting to train people in how to properly clean and maintain their stunner. That information is there. We also have it on an inline stunner here as well. This is an important part of this process. And again, as I say, when I go someplace and I'm checking to see how and whether or not they're accomplishing this task as they should be, this is one of the things I'm checking. Is this stunner clean? And have they been utilizing it right? We ask a lot of questions, and I want to know how this whole procedure is being accomplished. I also said that it's very, very important to know what the indicators of unconsciousness are. When I do this procedure, I'm totally focused on this animal the entire way through this thing until death. And that's the way it needs to be done. You don't fire the bullet or the captive bolt and walk away. You stay right there until you are assured this animal is no longer living. And it's important as well that we understand what to look for. When we're using captive bolt or gunshot, it's important that the animal collapses immediately. It makes no attempt to right itself. Any of those things would be very, very bothersome for me right there. The muscles become immediately rigid after the shot, followed by brief tetanic spasms and eventually some uncoordinated hind movements. All of these things I'm watching for. I want to see immediate and sustained cessation of rhythmic breathing. I don't want to see this animal breathe. This animal is breathing when it's down, I go fire right away again. I want to see an absence of eye reflexes and the eyelids remain open, facing straight forward. I want you to watch, then, this one. This one is done with gunshot, but even with gunshot, I watch for the same things, because the same things should apply here. Now here we're going to make the X first. When we're training folks in how to do this, we always make the X from the outside corner of the eye to the base of where that horn would be on the opposite side, right? I'm not a real good drawer, as you're going to see here in a minute, but we're close enough. And we also know that we should be, if measured from the pole downward, approximately no more than 3 inches or so to the point or to the intersection of the X. This is a steer that's quite fractious, and so we're giving it a little bit of tranquilizer. We did never get this animal to lie down. Why is that important? Because it affects to some extent the angle at which this bullet is going to hit this skull. I would prefer to it hit perpendicularly. When the animal is standing, it's not possible for it to hit perpendicularly. Sometimes that's going to affect the direction that this bullet goes, so that's important. Notice that the animal drops immediately. It is rigid, and now it slowly relaxes. Every time, captive bolt or gunshot, I'm watching for that. And now I'm watching to see if this animal makes any attempt to right itself. I'm going to go up and I'm going to check eye reflexes. I'm going to listen to the heart. I'm going to make sure that there is no rhythmic breathing. And I'm going to continue to watch that until I am convinced that the animal has died. That's the way we perform euthanasia, right? No matter how you do it, you need to be sure that you've accomplished your objective. Some things that have changed and things that are really, I think, quite important for us to know. The old site, if you look on the left there, was on the intersection of two lines, each drawn from the inside corner of the eye to the base of the opposite horn or to the top of the ear. I want you to also see that here on the right, that when it's done that way, you note that in fact where the white arrow is, that is ahead of the entire brain cavity. We missed the brain completely by using that particular anatomical site. That would have been a very ugly euthanasia, I'm sure. And so the point is that the anatomical site and the way that we find that is very, very important. The optimum position for cattle is at the intersection of two imaginary lines drawn from the rear of the eyes to the base of the opposite horn. Pole stunning should not be done. I see a lot of people that use pole stunning, but the problem with pole stunning is that your angle has to be absolutely correct in order to do damage to the brainstem. So many times people think that shooting from the pole is the better way. It's not the better way. It's the harder way to hit the brainstem. These are the unacceptable methods of euthanasia: manually applied blunt force trauma, the injection of chemical agents or substances or disinfectants, non-anesthetic pharmaceutical agents, etc. The injection of xylazine or any other alpha-2 agonist followed by KCl or mag sulfate, absolutely wrong. Don't do it. You cannot achieve anesthesia with xylazine. It is impossible. I know that. From some studies that we've done at Iowa State, we know it's impossible to achieve anesthesia with xylazine. Don't kid yourself with that one. Air injection into a vein, electrocution, and so forth. We need to be sure that we use the methods that we know are best for the welfare of the animals. And then I want to just finish by making a couple comments. Here in Michigan, a couple of years ago, when was it? I guess it's been maybe 4 years ago. Dr. David Miller gave a presentation that so many of us really were riveted by. And a couple of the comments that he makes, and I share the points that he makes about safeguarding fetal welfare here. But first of all, science accepts that higher order animals experience negative and positive subjective states or feelings. In other words, and this is important, animals are able to feel pain, distress, breathlessness, thirst, hunger, nausea, sickness. They're able to experience feelings such as anxiety and fear. You just have to accept that is reality. It always has been. But I love this question that was posed, and this is one I'm sure that many of you have, I think, or I hope would have thought about at some point. Have you ever wondered what happens to the unborn fetus once its mother has been euthanized? There's an awful lot of cattle go through the slaughter plant each day that are pregnant. What happens to that unborn fetus? Does it experience pain or distress? Is it drowning? And the question was asked of Dr. David Miller by his professor, Dr. Donald Barron. Have you ever wondered why a colt does not get up and gallop around in the uterus, but within a few minutes of birth gallops freely around in the field? Great question, huh? Great question. Jeez, great question. And as Dr. Miller pointed out in that session, that it has a lot to do with neurological development. And it's different for different types of animals. We have the exceptionally immature types, those that are represented by marsupial joeys and opossums. They're born early and remain in the pouch for several months, not conscious prior to birth. They require several months, in fact, to become fully conscious. Why am I talking about that? Remember the criteria that I said for an animal to feel pain is they must be sentient and they must be conscious, right? Then we take the moderately immature cats, dogs, rabbits, and rats. They're not conscious prior to birth. They require, in some cases, as much as 4 to 14 days to reach a conscious state. Then we have the neurologically matured birth, represented by cattle, sheep, and horses. They exhibit consciousness within minutes to hours of birth, but they're not conscious prior to birth. The onset of sentient unconsciousness, you see, is an important thing with respect, of course, to sensing anything and being able to experience anything. You see, although these animals develop the capacity for sentience in utero, they remain unconscious. During the last 40% of gestation, 8 or more known neuroinhibitors actively maintain the fetus in a sleep-like unconscious state. After birth, now you're going to really see how miraculous birth is. After birth, the onset of consciousness occurs. The effects. I'm sorry. The effects of neuroinhibition are reduced. Neuroactivation increases. Respiration relieves the hypoxic state, right? And the loss of placenta reduce the availability of cortical-derived neuroinhibitors and their precursors. What protects the fetus from those physically stressful events right at the time of delivery, right? Which we've all experienced, right? 3 mechanisms. O2 use by the brain, the oxygen use by the brain, because of the sleep-like unconscious state, is dramatically reduced, you see? There are other O2 sparing changes, oxygen sparing changes. Fetal motor systems become quiescent, and then there's the emergency response, right? Occlusion of the umbilical cord, which is bound to occur as this calf enters that very tight place right in the birth canal during the time of calving. They note that when they look at the EEGs in these animals, that in fact the oxygen requirements are reduced by 95%. Incredible, right? That's what protects the brain as long as blood flow is reinstated within 5 to 6 minutes. And it also protects the brain during the period between severance of the umbilicus and the onset of breathing. What are the practical applications? Well, how we handle fetuses and packing plants. Very important, right? Because fetal calf serum is a premium. It's worth lots of money. And it's one of the things that becomes very important to the packing plant, because fetal calf serum is used in research laboratories and many other medical pursuits, and it's a very valuable asset to the packers. So we know that we should not remove this fetus sooner than 5 minutes after the neck is cut. We should never, or alternatively, not remove the fetus for at least 15 to 20 minutes after the slaughter of the dam. Leave the fetus in the uterus of the dam until it is dead, right? That's the object. That's the objective. And so I want to believe that that is how it all works. And the preponderance of information suggests that that is how it works. In summary, barbiturates, barbituric acid derivatives, that's one approach. Gunshot is another. Penetrating captive bolt and adjunctive methods is another. It's important to know how to apply all of these. Whether you are a veterinarian or you're a livestock owner, you need to know how to do these things. The biggest challenge is this: no one likes or wants to do it. Too many animals die, gosh, awful, horrible deaths on our farms, simply because someone can't overcome the emotional inertia to do it. The decision's not always black or white. Ask any veterinarian. We know it's not always a black or white decision, but when it is obvious, that there is no way to prolong this animal's life, and certainly a good quality life, it's time for euthanasia. But we will all be afraid, and we all have those lingering thoughts, did I do it too quickly? And that's why I leave you with this, because I really like this. Better a week too early than it ain't too late. Right, Bernie? So with that, I close. Thank you.